the Respiratory Therapist Live Out Loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everyone. Welcome to anybody new. Welcome back to Rts Share Tea. And today's episode is going to be amazing. I have another guest co-host with me here today, and he is very talented. So before I let Marvin Joseph do his thing, I'm gonna give a brief I'm going to introduce him through his bio. All right, guys. So hang tight. Hopefully I don't mess it up. Okay. So Marvin Joseph is the president of the startup business MJ Enterprises Respiratory Care Services and the director of respiratory therapy at Meadowbrook Care Center in Freeport, New York. Throughout his 15-year duration in the healthcare industry as both a paramedic and a respiratory therapist, his realization of nearly impossible accessibility to certain respiratory supplies and equipment resulted in the creation of the business. So prior to the director position, Joseph has worked in hospitals, skilled nursing homes, and rehabilitation facilities, and home care. He holds an associate's degree in applied sciences, a bachelor's of science, and a master's in business administration with a healthcare management concentration. In his spare time, he invests substantial efforts in his compilation music label with an album release on the way. Yes, talented. I told you. All right. So, yes, everyone, welcome Mr. Marvin Joseph. Yay! Welcome, Marvin. Thank you for being our guest co-host on RT Share Tea. How you feeling today?
Thank you for having me, Linda. I appreciate it. I appreciate it very much. Hello, everyone out there. It's a pleasure to be on the show. Thank you very much.
Marvin. So, okay, Marvin. So pretty much I know your story. So, I've been following you on your social media platforms and whatnot. So, but I'm going to give you a chance to, tell your story. And we all have one about how we got into this field. So, what attracted you to the field of respiratory therapy, and just doing this line of work?
Well, it was actually a tragic occurrence in my family that actually that actually got me into the field. Many people they do their research and then they look at what they could possibly be in life. But me, it wasn't until the passing of my grandmother that I actually discovered the field of respiratory therapy.
Wow.
I was actually going to school for paramedic, and during my time in the program, she had passed.
Wow.
And
Sorry to hear about
prior
that.
to her passing, thank you. Prior to her passing, she was on a ventilator. The device that we use to help us breathe, right? Or to breathe for us when we're unconscious, right? She was given a sedative to relax her on the ventilator, and the doctor had to ask my father if he wanted to, as they say, pull the plug,
right?
Because she was not waking up.
Yeah.
So, I didn't know what that was, and I did more research after I graduated from my medic program. And as a medic, I became more and more fascinated by respiratory therapy. So that prompted me to go back to school. Once I finished the program at Long Island University in Brooklyn, and the rest is history. Yeah.
All right. I also went to LIU, by the way. So yes.
Oh.
Yes, we know.
Very nice. Very nice.
We know the same peeps. Okay. So yes. Okay.
Yes,
okay. And so, and so, did you feel like being a paramedic? Did you feel like that was like a good segue into respiratory?
Oh, most definitely. Pre-hospital care or paramedicine. it's one of the best gateways to a plethora of disciplines within the
I would
healthcare
imagine.
field.
Yeah, that
Yeah,
makes
because you're
sense.
touching up on everything. You're touching up on anything. You're basing your knowledge of what you applied in EMS to whatever centered discipline you'd like to focus on. So
Right.
I decided to go with respiratory therapy, and it's been taking care of me ever since.
Nice. I know.
Um,
We well fed over here. So
oh yeah,
yes, yes, yes. Always say that. Uh-huh. No
yeah.
skinny therapists over here.
Nah, nah,
um,
nah.
so okay. So that is great to hear your story. So now we are at a time of, oh my gosh. So for those of us who do not know what a RTpreneur is, RTpreneur is a word that I come up for, a respiratory therapist that has their own business, that is doing, their side hustles, and that word segues from the respiratory field. And so what made you say, like, you know what, I can have my own business? What, so talk to us about your business, and then put us through the journey. What led you to say this needs to happen and I can do this?
Well, first and foremost, the name of the company is MJ Enterprises Respiratory Care Services,
Mm.
LLC. This was founded by me, of course, about 3, 4 years ago. And
Nice.
what started the idea, it came from my time working in home care.
Hmm.
In home care, it's another monster entirely from
Yes,
the skilled nursing homes and hospitals.
I
It's a
know.
whole other ball game. So
Yes, it is.
with the home care, with home care, it was I realized that a lot of people, a lot of patients and families, caretakers, they had a lot of issues when it came to caring for their loved ones, seeking medical services. The
Right,
insurance was always an issue. Um, certain therapies and certain procedures cost a lot. It's not always
right,
as affordable as people think, even with insurance.
right,
So I decided, let me start up a company where I can not only assist with relatives and patients, but also bridge the gap between doctors, nurse practitioners, and physician assistants. So the company itself is three in one. It's respiratory consultation. It's
okay.
also a durable medical equipment company, or a DME for short.
DME, okay.
It's also a trach tube replacement company where I either go to you or you can come to my clinic and we can perform a tracheostomy tube change.
Nice. Okay. So you saw
Yeah.
the need. Definitely there was
Right.
a gap, and you saw the aha, like, I have the solution for it, and you went for it.
That's right. That's right.
Amazing.
There are
Amazing.
often, definitely, there are often times when, we're working as professionals and we don't realize just how hard it is for certain families and patients themselves to not only seek the help that they need, but also maintain that help,
Right,
it's
right.
often a cap. So,
It's
mhm,
another beast when you go home. It's like, they leave, and it's and like you said, it's just even the coordination alone. It's like we're talking about the money, and not just the money, just the coordination, the where do you go, or it's just a lot. And especially for, like, minority families, so just
definitely,
navigating through the system.
definitely.
Yes, yes,
Yep.
yes, yes, very. Okay, good. So okay, so what were your okay, so now you're like, okay, I'm in this space with DME and performing consultations at home, trach cares, we're changing the trachs and whatnot. What were your what, if any, challenges? What were they?
Well, The first challenge that I had endured was the clientele. You know, people, they view doctors at times as the go-to for nearly
Mm-hmm.
80% of their needs. So the
Right.
challenge was convincing my clientele that the same procedure that you would normally have done at your doctor's clinic is be done at home or clinic. So they, of course, know their MPs, as they should, you know, their PAs, but also I work under a doctor's license. So
Right. Right.
whatever the doctor prescribes, you know, that can also be, you know,
Joseph, I'm sorry. I think I'm losing you a little bit. Can you repeat?
do you hear me right now? You got me? I'm clear?
You're okay, you're coming back. Yes, go ahead.
I'm good? Okay.
Go ahead.
Well, I'm not sure how much of that you heard, but I was just stating that the trust factor between the clientele was the main
Mm-hmm.
challenge.
Okay. Okay.
Because many of our patients, the patient population, they steer more towards their doctors and their NPs and their PAs, which they, you know, which they should, but
Right.
also we as health professionals, we work under a physician license.
Correct.
So as long as the physician is knowledgeable, as long as they're notified, and they prescribe that certain therapy that the
Right.
patient needs, you
Correct.
know, that can also be executed in the home as well as in my clinic as well. So yeah.
Okay, okay. So yes, this is good to know. So just building that clientele, based on rapport and that you're able to do this work under a licensed provider. And I would imagine you have to have malpractice insurance and all that stuff to cover you.
Yes,
You know, and
definitely.
of respiratory therapists being cardiopulmonary specialists. I think some folks, they are really just like, are you the doctor? And it's like, no, I am the respiratory therapist, but under the license, and I have a written order, and I can do this in this setting. So okay, so great, thank you. That's really good to know. As far as a business, that you can go in that route if you feel skilled enough to do it. So yes, so and um I admire the fact that you feel confident enough to do that. Usually, like I've been in the nursing home facility. Usually it's like, two therapists. If we're gonna do a trach change, it's a few of us, just in
Hmm.
case something
Right.
happens in the facilities where respiratory would do it. And so I admire the fact that you do it in patients' homes. So
Right.
yeah, definitely a
Right.
skill. Okay, okay. Yes. So okay, so for anybody that wants to do something like this, or is like, what recommendation would you give to a therapist that's like they have a solution for something, and they want to do something new, they want to start their own business, and they're in the beginning of their journey? What advice would you give them?
What I would give them uh, is, with every discipline like respiratory therapy, there are subdivisions. There's always something that is needed, but there isn't uh, much assistance as far as professionals to render that care. So if you find a weak point in respiratory, for example, for you can actually do your research and, you know, study business also, because that merge of clinical and the application of business can, you know, allow
Mm-hmm.
you to steer more towards entrepreneurship. What I realized, I'll give you myself as an example. I
Yeah.
realized that again, there was that gap when it came to getting services rendered in the home,
Right.
getting that accessibility. So people always find
Yes.
there's a lot of issues when it comes to getting accessibility. I need
Yes.
this, or I
Yeah.
need that service, or I need that therapy. So uh,
Yes.
why can't we get it to them? Why can't we as professionals
Right.
do them? You know, what is stopping the clinician, that therapist from, you know, applying that therapy or whatever is needed to that patient
All
in
right.
their home? Now,
Yeah.
a lot of people, I want to make this clear so everyone understands that COVID has allowed the respiratory
Mm.
therapy field to surface in a way
I
where
mean,
we are 100% exposed now. If we were not before, we are now.
we out
So
here.
for
Yeah. Oh yeah.
anyone, oh yeah, definitely,
Yeah. Oh
definitely.
yeah.
So if
Mm-hmm.
there's anyone that would like to start their own business, I
This is
would
the time.
start with this is definitely, yeah, that's right. That's right. I would definitely start with what are the weak points? What do you see within the field that you could possibly assist a patient or family with? And
Right.
then you start from there.
Right. Amazing.
Definitely.
Yes. 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 That is great advice. This is the season. That's what I've been telling folks. It is,
Now,
it, especially when, because a lot of people in respiratory who are, burnt out, thinking of leaving. A lot of people have not fully explored the profession. They've only gone from acute care, and it's like, which is a good baseline or the foundation. We a lot of us
right.
start, primarily in acute care, and then once they're over acute care, it's like they're ready to leave, and it's like, well, you haven't really explored the other opportunities, and you sometimes you have to create your own opportunity, and it really is
Oh, most definitely. Definitely.
finding where you shine. So you see, you shine with, the trait changes and trait care, and and I've done that, and I do it, and it is not my, like, it's not my judge. Like, I do it, but it's just like not. So, but I'm over here in the asthma corner. So, like, the asthma education field has been where I shined, and I've been able to have other opportunities on top of that. So that's what I try to, when I do these RTpreneurs segments of the podcast of Rts Share Tea, that is the purpose behind it, is to show you, like, you can do this. Like, it doesn't,
Right.
once you have that aha moment and you're confident in your skills, and you keep investing in your skills, you keep,
Hmm.
learning, you're not
Definitely.
scared to learn.
Absolutely.
I mean, the opportunities is like, it's it's there, it's there. You know what I'm saying? So thank you for that. Thank you for that. Appreciate that. Okay,
Oh, no
so
problem. No.
Marvin, this is your time to plug. What you got going on? I know you do other things. You already spoke about the music, or the record label.
Yes.
So where can we find you? What you doing? What's hot in the streets? What's going on? Let us know.
Well, on the respiratory sector, I'm on social media. You know, I'm on Facebook. I'm on
Mm-hmm.
Instagram at MJ Enterprises RCS. That's MJ Enterprises RCS. I'm also
We're
on the
gonna put it.
music segment.
I'll put it on the
You know,
description. I'll put it down in the description.
oh,
Don't
thank you
worry.
very much. Thank
Mm-hmm.
you so much. Appreciate
No
it.
problem.
Appreciate it.
Mm-hmm.
Um, I I entered music at a very early stage. I used to play keyboard. I
Okay.
used to also play
Nice.
guitar.
Okay.
Yeah. Uh, can't say that having my son caused the pause in that. It was just there were other opportunities business wise.
Okay.
And when you find other means to make money, you tend to put aside what the hobbies that weren't so lucrative.
Right.
So
Of course.
moving forward, I did want to contribute in another way to music. So what I decided to do was create a label, a music label, And
Nice.
I asked myself, how would I make this a bit different from what other labels, you know, are doing? No disrespect to what they're doing for the industry, but I wanted to see how can I give up and coming artists, aspiring artists, you know, a platform.
Right.
So I decided to create Indigo Stream Entertainment, which is a label that focuses solely on composing songs from many artists from different walks of life, from
Okay.
different genres, ranging from hip hop to Afro beats, even on
Nice.
the international sector.
Right.
We have Caribbean artists as well.
Yeah.
So for this first album that's coming out, it's called Eclectic Aftermath. Eclectic
Eclectic
Aftermath.
aftermath.
Yeah.
Okay.
The name of it sounds very difficult because it didn't come from me. I'll tell you right now. It came from one of my team members, and
Okay.
I have to say that it resonates because of the fact that people are eclectic when it comes to music,
Right.
and
I listen to
the
everything.
aftermath. Yeah, exactly. So you
Everything.
pretty much
You
know.
wouldn't
You
think.
pretty much know.
Right.
You know what? It wouldn't really surprise me too much to find people listening to everything, but
Everything under the
under the
sun.
sun, because you have genres now that are not so specific. Now you have
Right.
artists that are merging into different other genres.
Mm-hmm.
So,
Yeah,
I
yeah.
just decided let's keep up with that. The aftermath wording, that term came from the point of the project.
Okay.
For our first album, it's a compilation of different songs and spoken word, and it focuses on events that have transpired in 2020. So that could
Yeah.
be good, that could be bad, it could be
Right.
indifferent. So as of now,
COVID
we
time.
currently have it finalized. Yeah, it's pretty much done. It's just the process of marketing and release now.
Nice, nice. Well, Marvin, I mean, you a busy man out here, so but that's good. It's a good busy. It's a good
Yeah,
time. And then
that's what it is.
look at you now. You're a guest co-host on RT Share Tea, and you are sharing the tea.
Thank you so
Very,
much.
very, very. We are just so happy to have you. And I once again I commend you for being out here and just doing what you do and taking care of people in the minority community in that space. And like we said, I always speak up and I'm an advocate for people having access,
Hmm.
and this is such a, and especially during COVID, it was a hard time for a lot of people, and just
Definitely,
getting
yeah.
access to things in the healthcare field, and I've seen it myself. So once again, kudos.
Thank you.
All right, Marvin.
Thank you
Well,
so much.
yes, we wrapping it up. So yes, thank you again, guys. So guys, thank you so much for watching. Thank you, Marvin, for being my guest co-host. Remember, we are here every Wednesday on Google Podcasts and wherever you can catch podcasts. And we are on YouTube every Thursday. And remember, guys, to always invest in yourself and to only compete with yesterday's version of you. I'll see you next week. Bye.